Well, good evening, everyone. I want to introduce Jenny Galbraith. Did I say that right, Jenny?
Yeah, close enough, Galbraith, but that's good enough for me.
Okay. We do have some Galbraiths in Edgeley too, but they're veterinarians. Did you know this?
I knew that they existed. I don't think we're related at all, funnily enough, but yeah, I knew they were down there.
Okay, good. Anyway, Jenny's going to talk to us about immunizations for children and youth, and part of that is COVID-19 and some of the other immunizations. So she comes from the Department of Health, and I'll let her do some introductions also.
Perfect. Sounds great. And I will just share my screen here and get us started. So, like was mentioned, my name is Jenny. I'm with the North Dakota Department of Health. I'm actually the adult immunization manager for the department, but underneath my program falls a COVID vaccine group. So you're stuck with me here today. I've been with the Department of Health for about 5 years through a couple different positions, but one of those positions was the vaccine preventable disease epidemiologist. So I am well versed in these diseases and the vaccines that we can use to prevent them. So I will just go ahead and get started. Before I start and just jump into the actual diseases and vaccines, I like to start with what are the vaccines that are even recommended for our kiddos, because there are a number of them, just to be perfectly honest. So here we have the schedule of vaccines that is recommended for kiddos from birth through 6 years of age. So as you can see, there's a number, and you get multiple doses of a lot of these vaccines. I will say, and I like to tell parents this looks like an overwhelming amount of vaccine for one little kiddo that's just a baby. But we have a lot of combination vaccines now, meaning that when you look at 2 months old and see that they get all these vaccines, they probably aren't getting an individual vaccine for all of these. There are combination vaccines that include a lot of different components, so you're getting really not as many as you think you are. Next, we can look at the 7 to 18 years olds. As you can see, there's a lot less because we do a lot of our vaccinating when our kiddos are at our most vulnerable, so that less than 6 years of age. Over here on the right, all of these are something that you would have gotten as less than 6 years old, but there are certainly some kiddos that don't get them on time, so we include those. Dengue, you're not going to be getting that vaccine in North Dakota. That's not something we have up here, so we can skip this one. This pneumococcal is only for kiddos with certain underlying health conditions, so that's not something that every kiddo gets. This Men-B right here is something that only kiddos that meet kind of the qualifications and talk it through with their provider would get. So again, not everyone. What we're really looking for are these green slabs here. So really, we're only getting, once you're out of the age of 6, a handful of vaccines. By the time you're really, 16 years old, a lot of kiddos are just getting their flu shot every year until you're an older adult. So not as many as we first think when we're looking at these schedules. I always like to also mention why vaccines are important for school and childcare, because we hear a lot of the time a push for vaccines before kiddos get to school, before kiddos get in daycare. And here is why. When you have a vaccine preventable disease and are symptomatic and infectious, you have to be out of school or have to be out of daycare for a certain amount of time. Depends on the disease, how long it is. But what happens is that kiddos are missing a really important part of being in the education system, being in childcare, and really having that development and learning back and forth with their peers. And we know, especially during this COVID-19 pandemic, that kids need to be around kids that they're learning from, that they can kind of interact with. So we don't want kids out with vaccine preventable diseases. I'm going to especially call attention to this measles. It's kind of our big brother vaccine preventable disease, the one we all are really nervous about. If you have measles, you're out until 4 days after the rash disappears for your measles. But if you're unvaccinated and came into contact with that measles infected student, you are out of school for 21 days after that. And then if you're in an outbreak situation, that just keeps compounding on top of each other. There are times, and we've seen it recently in the United States, that kiddos are out of school for months if they are not vaccinated and around measles outbreaks. I also like to talk about why we get vaccinated as a group and have to worry about kind of the global community of vaccination. So number one, there is not a single vaccine that is 100% effective. Does not exist. We have some that come close. We have some that are really good, but nothing is 100% effective. So the more people we have vaccinated, the better chance we have that the disease is not going to spread back and forth. For measles, which again is kind of our most infectious, the one we watch out for the most, you need actually a 95% coverage rate. So 95% of the eligible population needs to be vaccinated for measles to stop it from spreading within a population if it's introduced. So that's a really high rate. So we really have to think about everyone in our community when we're making that decision. And we also really need to think about the people who can't get vaccinated. And I'll show you more clearly on the next slide, but there is a population of people that cannot get vaccinated, and it is kind of our duty, our job to protect them by getting vaccinated as well. So who can't get vaccinated and who relies on that herd immunity? It might be someone who has a contraindication is what we call it. And a contraindication for vaccines would be something like an anaphylactic allergy to a component of the vaccine, meaning you are allergic to a component, cannot get it, you are medically unable to get it. Someone who is immunosuppressed. So this might mean that they aren't mounting as good of immune response to the vaccine as someone with just a normal healthy immune system and rely on us to kind of boost their immune response. And then it also might look like someone who is too young to be vaccinated. We can't get every vaccine just as we're born. So really we're doing our job protecting those babies by getting vaccinated. So I'm going to lead us through kind of the normal vaccines for our kiddos under the age of 18, starting with hepatitis B. And really that's the first one we get. So first, I think it's really important because a lot of these we don't see anymore to know what hepatitis B is. So hepatitis B is a liver infection caused by the hepatitis B virus. For some people, it is an acute, short illness. You clear up, you go about your day, and you're fine. For others, it can turn into really a lifelong, long-term liver problems and a chronic illness that is just really debilitating for some people. No one really knows who's going to get the acute and who's going to become chronic. There isn't a way to for sure say that. The most common way that hepatitis B spreads is through sexual activity with a hepatitis B infected person. If you're sharing contaminated needles or syringes, and that would be from injection drug use, or for babies who are born to hepatitis B infected mothers. We do still have hepatitis B in the United States and in North Dakota as well. In 2020, we had about 80 individuals who had chronic hepatitis B, and that could be underreported. But really in the United States, the numbers are a little bit hard to tell, but we have potentially up to 2 million people living with chronic hepatitis B. It's not something that doesn't exist anymore. So we vaccinate for hepatitis B, and because of that risk that mom might not know she's infected, we vaccinate for hepatitis B right away. So really within 24 hours of birth, a baby will get its first dose of vaccine and get that first dose of hepatitis B vaccine. And then we have 3 total doses. So you get your first, like I said, at birth. The next one is at 1 to 2 months of age, and then the next one at 6 months old. The good news is after you get those 3 doses for most of the population, you are done. You are never going to need to get another hepatitis B vaccine, at least right now as current recommendations. Next up is rotavirus. And rotavirus is a very contagious virus that can cause diarrhea and lead to really some pretty extreme dehydration in kiddos. Before the development of the rotavirus vaccine, most children in the United States were infected at least once before they turned 5 years old. It was very common. In fact, prior to the vaccine, there were more than 400,000 doctor visits annually from rotavirus, and there were up to 60 deaths from kiddos. And I know 60 doesn't always seem like a lot, but I think when we have something that's vaccine preventable, any death is really too much for us. It's a little bit hard to track where rotavirus is in the United States now. It's not something that's necessarily easy to track and reportable, but we do still see outbreaks of rotavirus in the post-vaccine era. And this one particular one I'm mentioning here at the bottom of my slide, there were 3 separate outbreaks. It did occur amongst people who were, or kiddos who were vaccinated and kiddos who were unvaccinated, because like I said, no vaccine is perfect. But what we really showed was that the rotavirus vaccine was protecting against serious illness. The only death within these 3 outbreaks were from one unvaccinated child. So we all get vaccinated for rotavirus, or hopefully we all do as children now. The dosage and the schedule really kind of depends on which vaccine you get. It's not as clear cut as 3 doses of hepatitis B. So it'll kind of depend on what your doctor has. You may have 2 doses of the Rotatech vaccine, which is given, 3 doses of the Rotatech vaccine, which is given at 2 months, 4 months, and 6 months of age. Or you may have 2 doses of the Rotarix, which is given at 2 months or 4 months. There's a couple caveats with the rotavirus vaccine. The first dose should be given to a child before they are 15 weeks of age. And really after you turn 8 months of age, we stop vaccinating for rotavirus. So you have a little bit of a more limited window in there when your kiddo can get vaccinated. But we really encourage that all kiddos are getting vaccinated for rotavirus, because really that dehydration is really severe in some of these kiddos. And you may see that this is a little bit different vaccine. You're not getting it as an actual shot into your leg or to your arm. You actually get this by putting drops in the infant's mouth. So it's not quite the same as the other vaccines we see nowadays. Next, we're going to talk about a combination of diphtheria, tetanus, and acellular pertussis. First off is diphtheria. This is a bacterial infection that spreads easily through sneezing and coughing. You'll see it kind of cause this really thick covering in the back of the nose or throat that makes it really difficult to breathe and swallow. But it can lead to some pretty severe complications, heart failure, paralysis, and death in some cases. Diphtheria is kind of on the rise globally, not necessarily in the United States, but globally, we're seeing an increase. In 2019, there were about 23,000 reported cases. I use 2019 because once we hit the COVID-19 pandemic, we stopped traveling. It's really hard to say what's actually going on with diphtheria right now. But in the United States, for the era of vaccines, there were up to 200,000 cases of diphtheria annually. And we had probably about 13 to 15,000 deaths reported annually. So this was not something that was small. Gradually, though, we've seen a decline in cases as we've introduced vaccine, and then actually moved to universal vaccination against diphtheria. That's really when we saw our huge decrease. So when you look at the numbers now from 1996 through 2018, which is a really long time, we only had 14 cases of diphtheria reported in the United States, average of one less than one a year. So I mean, this vaccine really has worked really well in the United States at eliminating diphtheria as much as we can. Next up is pertussis, or you might hear it called whooping cough. So this is a highly contagious disease that's especially dangerous for our little babies. You get the name, the whooping, from the sharp breathing in sound right after a coughing fit, because this is uncontrollable, violent coughing. It is not a coughing that you have just from a light cold. If you see in this picture to the right here, this is actually a kiddo who coughed so hard from pertussis that they broke the blood vessels in their eyes. So this is not just a normal cold. For babies, like I mentioned, it's especially life-threatening because it can lead to actual pauses in the breathing when you're not coughing. This is why, and you've probably seen commercials and education for it, that we recommend actually mothers be vaccinating during each pregnancy to try to pass protection on to the babies before they can actually be vaccinated. Unfortunately, in the United States, we do still see outbreaks of pertussis. Really, there's been a number of outbreaks and a number of cases. So I have here since 2010, there's probably been about 15 to 50,000 cases reported yearly. It does kind of go in swings. And that holds true in North Dakota. These are cases of pertussis from 2004 to 2020. As you can see, our baseline kind of sits in that 50 or so range, but we do get swings of large outbreaks. As you can see, back in 2004, we actually had almost 800 cases of pertussis reported in North Dakota that year. So really, this is something that is still happening. And then lastly, in this combination vaccine is tetanus. We've probably all heard about it and probably all been warned by our parents that you don't want to scrape your knee on the rusty whatever because you're going to get tetanus. So this is a potentially fatal infection that's actually caused by the toxin made by a bacteria, and it causes that painful muscle stiffness. So in that left-hand side picture on the bottom, that is someone in a kind of the classical depiction of tetanus. It's not spread person to person, so that's good news, but it is present in the soil and can contaminate wounds. Luckily for us, though, the tetanus vaccine was very, very effective once we started introducing it and actually using tetanus antitoxin for wound management. So we introduced the vaccine in kind of the late 1940s or so. And as you can see, with that continued use, we've gotten down to very few cases. That being said, we still do have sporadic cases, mostly though in adults that have not kept up to date with their every 10-year tetanus booster, or in kiddos who have not been vaccinated for tetanus. It's not really occurring in people who are up to date and are getting that tetanus vaccine. So this is a combination vaccine between all of these three for all these three diseases, and we get 3 shots as babies, kind of build up that high protection level against all of that. And then we get 2 additional boosters under the age of 6. So we get our first dose at 2 months, then 4 months, 6 months, some are then in the 15 to 18 month range, and then another dose at 4 to 6 years old. We're not quite done though. Then at 11 and 12, somewhere kind of in that early middle school years, we get an additional dose of Tdap, which is pretty similar to DTaP, a little bit different, but that then boosts your immunity and starts kind of your life off on that every 10-year booster cycle. Next up, we have Homophilus influenza type B. This one is a little bit tricky because it can cause a lot of different types of infections. It might be presenting in your kiddo as just a common ear infection, nothing too much to worry about, or it can cause meningitis, pneumonia, some pretty severe outcomes. No one really knows who's going to be infected by which type again. So this is why this one is really important to get. Normally, this is affecting children under the age of 5 years old, but it can affect adults if you have certain underlying healthcare conditions and maybe immunocompromised. Like I mentioned, there's some pretty severe outcomes from Hib. It can be meningitis, pneumonia, severe swelling in the throat, making it difficult to breathe. You can get infections in the blood, joints, bones, and covering of the heart, and it can lead to death, especially in our younger children. So again, luckily we have a vaccine that works for this. We again start our life off vaccinating at 2 months old for this. We get another dose at 4 months, and then depending on the brand you receive, you might get one at 6 months old, and then again at 12 through 15 months old. Next up is pneumococcal disease, really similar to Hib, where it can present in different types of infections. So you can have pneumonia, lung infection, which is the lung infections, the bacteremia, blood infections, can be a middle ear infection, meningitis. Again, really difficult to predict who's going to get what type of infection. But pneumococcal disease can be very serious, and we still do see a number of hospitalizations and deaths every year from pneumonia. But again, we have a vaccine schedule and vaccine that works really well against actually 13 types of pneumococcal bacteria that can cause these serious infections in children and adults. So we have the doses of we get 4 doses, 2 months, 4 months, 6 months, and then again at 12 through 15 months old. Next up is polio, and we do still vaccinate for polio. I think a lot of people forget about this one. So we all kind of know what the classical polio looks like. It's the iron lung, but it was caused by the polio virus that infects the brain and spinal cord that causes paralysis. It can be crippling and deadly, and the virus is spread from person to person. Luckily in the United States, we've really eliminated polio, but polio does remain a threat in other countries globally. In fact, I just want to call special attention. Mozambique actually had 30 years of no wild type polio cases, and then now they're considered in a polio outbreak. This is something that really still exists, and it's kind of crazy we're even talking about polio, but we are, and we still need to be vaccinating against it because really in this world, we're one plane ride away from getting something like this. Just wanted to call special attention to how good this vaccine was. In the 1950s, we had a lot of cases of polio. It was, a scary time for parents. As we've introduced vaccines, we've gotten less and less cases. And actually since 1979, we have had no cases of polio that have originated in the United States. So nothing new has happened here. We have had a handful of cases that happened when someone brought polio in, but that also hasn't happened since 1993. So it's been a long time since we've seen polio in the United States. And I would really like to keep it that way. So like I said, we do vaccinate for polio, and every child should receive 4 doses. Those are at 2 months, 4 months, 6 through 18 months, and then again at 4 to 6 years old. And really that's getting them vaccinated before they start congregating with other children in school. Next up is influenza, and it's another one people forget about, but it is a vaccine preventable disease. Everyone probably knows what flu looks like. It's a respiratory illness that infects the nose, throat, and lungs. It really can affect people differently. You may get a relatively mild case of flu if you're relatively healthy and you're kind of a young adult age, but it can be dangerous for some people, especially in our children just less than 6 months old, and then in our older population. We actually do see every year otherwise healthy children die or be hospitalized from the flu. This is not something that you should take lightly and just say, oh, it's just the flu, it's fine. Kids do die of this, unfortunately. And we do see kind of wild swings in our flu numbers year to year in North Dakota. 2020 to 2021 is probably not a good year to look at. We weren't really doing much. We were still kind of in the midst of COVID here. But the year before, we actually had our highest number of influenza cases ever reported in North Dakota. And I will say this year, in the 2021-2022 season, which isn't on this graph, we've had over 10,000 cases again. And a lot of those cases were in children. And again, we don't want to have a kiddo die of something that's really easily preventable. So actually everyone over the age of 6 months old should get a flu vaccine yearly. But there are certain populations that should especially pay attention to this. So like I said, the little kiddos, pregnant women should really get a flu vaccine during pregnancy to keep them safe. And any caregivers or close contacts of infants who are too young to be vaccinated should really get a flu shot as well. Next up, we have measles, mumps, and rubella. So measles is highly contagious. We've talked about this already, but you can actually get measles by being in a room that a measles infected person has left up to 2 hours ago. So it is very infectious. We don't really see or hadn't really seen a lot of outbreaks in the United States up until recently, but it's very common in other parts of the world now. And we're starting to see outbreaks now in the United States. So here's again a map. Again, 2020, 2021, probably not great to look at. But in 2019, we actually had almost 1,300 cases of measles reported in the United States. That is a lot of measles for a country that we thought had eradicated measles. Mumps, we also still see regularly. So it's a contagious disease, it has no treatment. And really the classical signs of mump is that swelling in the jaw, which is the swelling of the salivary gland. But it can lead to other serious outcomes. Swelling of the testicles, deafness, encephalitis, and meningitis are a potential side effect or potential serious outcome of mumps. And we still get cases every year in the United States. And really the outbreaks involve that close contact with infected people. So classrooms, sports teams, really where you have that close level of connection. And really, you know, classrooms and sports teams are where our children are at. In North Dakota, we don't see a ton of measles, but we do still see some. In the United States, kind of pre-COVID, we saw kind of about 3,000 cases a year. North Dakota, we see, you know, normally less than 20 does not mean we cannot get an outbreak though. Last up in this combination, we have rubella, which is also known as the German measles. It's seen kind of as measles, but maybe less severe normally by kind of the everyday people. Spread by coughing and sneezing. But what's really important is that pregnant women and developing babies are at really high risk. So it can cause miscarriage or death right after birth, but it also can cause some pretty serious birth defects in babies. And the one that we see or have seen from rubella is the cataracts in the eyes. So before the rubella vaccination program started in the United States in 1969, rubella was very common. In the last major rubella epidemic, that was between 1964 and 1965, there were an estimated 12.5 million people who got rubella. 11,000 pregnant women lost their babies, 2,100 newborn babies died, and we had about 20,000 babies who were born with that congenital rubella syndrome. Today, less than 10 people in the United States are reported as having rubella each year. And this is after that vaccination. And we really haven't had cases of rubella that have started and been infected in the United States since 2012. All of our cases since then have been seen from people who were traveling outside of the United States. So the MMR vaccine is relatively easy. There's only 2 doses you need to receive. And the first dose is at 12 to 15 months old, and the second dose is at 4 through 6 years of age. Again, before we start congregating in schools. Next up, we have chickenpox. And I know a lot of people always say chickenpox. I had that as a kid. We had parties for it so I could get it and get out of the way. But it is really something that is serious. Before we started vaccinating, about 4 million people a year got chickenpox, and up to 150 people died each year. It's really important that when we're talking about that chickenpox is mild or that my measles was mild when I was a child, that you remember that there were people who died and they're not around to tell their story. And that's something that we call survivor's bias. So it's really important that we remember that it's not always a simple childhood disease for everyone. But everyone should kind of know what chickenpox is. It's the blisters and the rash all over the body, can be particularly serious and life-threatening in babies, and then people with a weakened immune system, and even healthy children can get very ill. We do still see chickenpox in North Dakota. This is likely underreported because these are really lab confirmed cases of chickenpox, and there certainly are still children who would get diagnosed just based on the look of their chickenpox, but we see kind of anywhere in the 20 to 50 cases a year normally. Again, this one is really easy. It's basically the same schedule as the MMR vaccine, 1 dose at 12 through 15 months old and 1 dose at 4 through 6 years. Next up, we have hepatitis A. So similar to hepatitis B, this is something that can cause liver infection. Though most people who get hepatitis A, this is a shorter term illness, though they can still feel sick for a few weeks to several months, but they will generally recover at the end. Though it can cause and has caused liver failure and even death in some individuals, especially those with like chronic liver disease. Typically for hepatitis A, we see symptoms such as the jaundice or the yellowing of the skin or eyes, upset stomach, diarrhea, really tired, dark urine, kind of those general symptoms in there. What's really important to know, though, is that not everyone with hepatitis A develops symptoms. Really, adults are the most likely to have symptoms. The young children, like daycare age, might never develop symptoms of hepatitis A. And in fact, you might not even know there's a hepatitis A outbreak within a daycare until the adults start getting sick. Oh, there we go. So we still do see some hepatitis A in North Dakota, but we really have been seeing a number of outbreaks in the United States that haven't really affected us yet, but there's still always a potential. In fact, since 2016, there's been a large multi-state outbreak of hepatitis A, and there's been over 44,000 cases in that outbreak. That's all kind of connected by the same risk factors in there. And what's really important is that there's been over 400 deaths within that group. So again, we can get vaccinated through this. There's no set necessarily month schedule, so this one's a little bit different. You get your first dose somewhere between the age of 12 months through 23 months. And you just get your second dose 6 months later on this one. Next up, as we move towards more of our adolescents, we see HPV or human papillomavirus. So HPV is really an infection that can cause lesions and certain types of cancer. So it's really important to remember that this is something that causes cancer, and we have a vaccine that really prevents cancer. A number of types of cancers are kind of included in that HPV virus family. I have that down on the bottom, so I'm not going to go through it. But this is spread through intimate skin-to-skin or sexual contact. And I know a lot of parents always feel like we were vaccinating really early for this, and my kid is not going to do any of that just yet. But it's important that we get kiddos vaccinated before they start having that intimate sexual contact with individuals. So we vaccinate for HPV. It's a little bit tricky of a recommendation, so it kind of will depend on how old your child is when they start the series. But we routinely recommend it at 11 to 12 years old. But you can start it back to even 9 years old. You only need 2 doses if you're given the first dose before the 15th birthday. But if you do start it later, you would need then 3 doses. So a little bit more complicated of a recommendation here. Next up is meningococcal disease. So this, kind of how it sounds as its name, can cause meningitis, which is the infection of the lining of the brain and spinal cord, and potential infections of the blood. Even when treated, this can kill 10 to 15 out of every 100 people. So it is a very serious disease. And then of those survive, 10 to 20 out of every 100 suffer from disabilities such as hearing loss, brain damage, kidney damage, loss of limbs, and even nervous system problems. Our most high-risk groups are infants under 1 year old, adolescents and young adults from 16 to 23, and that's because of the close contact with each other, and then those who are immunosuppressed. I don't have any numbers here because it is not something that's as easily to find of these numbers, but we do still have meningococcal disease cases crop up in North Dakota from time to time. And like I said, they are very severe. So we do recommend all teens get the meningococcal conjugate vaccine, which protects against 4 separate strains of meningococcal disease, ACWY. And you get those doses at 11 to 12 years old. So when you start that middle school, and then 16 years old, preferably before you hit college. We also have another vaccine, which is a meningococcal B, and that protects against serogroup B meningococcal. Not every teen is required or recommended to get this shot. So it's really something that you need to talk to your teen's doctor or nurse about to see if it's right for them. But if it is, the preferred age for this is somewhere between 6 through 18 years of age. And then next, kind of lastly, I want to talk about COVID-19. It's really important to know that COVID-19 vaccine is not any less than any of these other routine immunizations. COVID-19 is still something that now is, even if it's not fully vaccine preventable, it certainly helps to get this vaccine and should be considered. And you can get the COVID vaccine at the same time as you're vaccinating your kiddos for any other vaccine preventable disease. So these can be given at the same time. Starting off with a little bit of background on COVID, we should know all what this looks like by now. We've seen it for the last 2 years. Symptoms range a lot. You could be completely asymptomatic, never know you have COVID, but only know because you got a test, or you can go into respiratory failure and die, or anywhere in that wide range. It is really all encompassing. In the United States, so far, there have been just about 1 million deaths. There are probably more, maybe less. It's a little bit tricky to track, but there have been at least 1,000 deaths in children under the age of 18 years old. And not all of those were in kiddos who had underlying healthcare conditions. There were some kiddos that were really healthy that ended up passing away from COVID. And it's really also important to mention with this children population that we also have MIS-C. It's a rare but serious inflammatory syndrome in children that has been seen is seen in kiddos who were previously exposed or positive for COVID-19. So here is a recent screen grab of North Dakota's numbers. As you can see, a majority of our cases are kind of in that middle age group, but we do still have a large number of cases in this young age. Really, this is something that is affecting kids. just as readily as affecting other adults. So I want to talk a little bit about Omicron, which is really the kind of most recent predominant period we've had of COVID in the United States. So in children, the 5 to 11 years old, which is the youngest age range we vaccinate for now, the incidence rate, so meaning the rate that you're getting COVID-19 infection, so that symptomatic disease, was 1.3 times higher among unvaccinated children versus vaccinated children. Hospitalizations were 2 times higher amongst the unvaccinated children compared to the vaccinated children. And then we saw about 87% of hospitalized children during this Omicron period were unvaccinated. And 1 out of 3 of those children had no underlying healthcare conditions. But we have vaccines now for COVID-19, so this is really exciting. So the current recommendations for COVID-19, they're a little bit tricky, and it kind of depends on if you're considered part of the general public or part of the moderate to severely immunosuppressed population. So I'm going to start with the general public. So right now, everyone 5 years of age and older in the United States is recommended to receive COVID vaccine. So for the 5 to 18 group, so our kiddos that we're particularly concerned about tonight, they can get 2 doses of what we call a primary series. And really the only thing available for them right now is the Pfizer vaccine. Plus now newly, this entire population can get a booster dose. So you get your first dose 3 to 8 weeks apart for your second dose. And that really is dependent on your kind of risk factors, your personal discussions with your provider of how long you want to wait. And then now you get a booster dose 5 months after that primary series. For the immunosuppressed, it's a little bit more complicated. So in the 5 to 11 year age group, you get 3 doses in your primary series plus a booster. And we call that third dose just an additional dose, meaning that these are individuals who wouldn't necessarily mount a full immune response from those 2 doses. So we know we need to give them a little bit extra help to keep them protected as long as possible. So you get your first dose. Your second dose is 3 weeks later. Your third dose, or that additional dose, is at least 4 weeks after that. And then you get your booster dose at 3 months. The 12 to 18-year-old population is pretty much the same, except for now they are eligible for a second booster dose, given at least 4 months after that 4th dose. So they are eligible for a total of 5 doses. The 5 to 11-year-old group is currently eligible for a total of 4 doses. And these are recommendations that are flexible and potentially will change as we move going forward. I just wanted to mention really quickly who is considered moderate to severely immunosuppressed. It's really individuals who are very immunosuppressed. People who are undergoing current cancer treatments would be in this group. Someone with advanced or untreated HIV, someone taking medication that's really messing with your immune system. It does not universally apply to people who have chronic health conditions or a group like all long-term care residents. They are not universally considered in this population. Really, this is something that you probably need to talk to your doctor about, and you will have a doctor if you're a part of this group that you're routinely seeing. This is a little bit easier way to look at these recommendations and to the schedule here, but it's the same thing I just went over, so I won't spend too much time here. We get a lot of questions, though, understandably, about how fast we develop these COVID vaccines, and it's really important that parents have all the information when you're making the decision about being vaccinating or vaccinating your child, because we ultimately, as parents, want to do what's best for our children. So to answer the question about how we got COVID vaccine this quickly, it's kind of complicated, but this would be the traditional timeline for a vaccine coming to market. It can be 10 to 15 years plus. Really, you spend a lot of time doing exploratory trials, during the early clinical trials, and really doing a lot of this background work. The nice thing is when we had our warp speed for COVID vaccine, what we really did was cut a lot of red tape. So number one, we were able to overlap a lot of the steps and do an FDA rolling review of the data. So we didn't have to wait for everything to be done, then FDA reviews, then it moves on to the next step. We also, this exploratory and preclinical period in here was already done for the mRNA vaccines and really for for the coronavirus. We've had other coronaviruses. We haven't had COVID, but we've had other coronaviruses. We've done a lot of this work already, looking at a vaccine to prevent coronavirus. So really, it's not that we cut any steps out. We were just able to cut a lot of red tape by, quite frankly, funding, and cut a lot of the preclinical work that could take a long time to do. So really, these vaccines have gone through the same steps, just in a much shorter, much more condensed timeline. Oh, and I'll just go skip through all those here. But we still have a lot of questions about how we know COVID-19 vaccines are safe. And certainly, again, we want to make sure we're making the right decision for our family. I will say the US has the most robust vaccine safety surveillance system in the world, and that existed long before COVID-19 vaccine. And quite frankly, COVID-19 vaccine is probably the most heavily scrutinized vaccine product we have ever had available. We have really paid attention and really watched what COVID-19 vaccine can do very closely. But we do have a couple systems in place. So we have the Vaccine Adverse Reporting System, and that's VAERS, and you've probably heard about this before. This has existed for many years. So this is kind of an early warning system that monitors the safety of vaccines after they're authorized or licensed for use. What's really important to know, though, is that anyone can report to VAERS. Does not have to be a doctor. It can be any person off the street. And this does not determine any causation or any link between the vaccine and the actual symptom that's being reported. This is something we would call like a hypothesis generating system that we look for trends in, we go investigate, and then after those investigations, we're actually able to make a determination. We also have the Vaccine Safety Data Link, which uses electronic medical records from 9 large health systems to study vaccine safety. And it looks for the diagnoses and events that occur after vaccination within these health systems. We also have the Clinical Immunization Safety Assessment, which is again a network of 7 different research centers that do a lot of this vaccine safety studies. And then newly to COVID-19, we have Be Safe. And if you've been vaccinated for COVID, you've probably gotten a little card that has a QR code. You can sign up and you can have text reminders about your side effects, and you do some reporting through that system. You've probably heard the phrase, and I certainly have, I heard that thousands of people have died from the COVID-19 virus. Is that true? And a lot of this is coming from the VAERS system. I just want to, again, be super mindful that we're paying attention to what VAERS actually is. There's a difference between dying from a vaccine from dying after a vaccine. And VAERS, it includes a lot of people that have died after a vaccine. If you gave 10 million people a sugar pill over 2 months, you would see 14,000 deaths. I think we can all agree that sugar pill probably did not cause the death of these individuals, but you're going to naturally see deaths after giving something to people because deaths just occur. But really what we're looking for in VAERS and what we're looking for when we look at vaccine safety are patterns of deaths. And we're comparing those to the patterns of death if that vaccine or that product wasn't introduced. That being said, though, we do have some adverse events that happen after COVID-19 vaccine. I'm going to break them down here, but really we're going to focus on the mRNA vaccines because those are the ones that are available to children. So Pfizer and Moderna, you have the common things: pain at the injection site, redness at the injection site, some swelling, fatigue, headache, fever, muscle aches, chills, joint pains, things that people get after receiving any vaccination. We also do have some rare serious side effects. Anaphylaxis is one we've seen with mRNA vaccines. And really the big one in this age group that a lot of parents question is the myocarditis or pericarditis. I'll briefly mention the J&J vaccine, but the common ones are the same as above. But we've also seen blood clots, which are also called thrombosis or thrombocytopenia. And really the J&J vaccine is really limited in the United States now. we didn't like these blood clots, the FDA has come out and said we prefer the use of the mRNA vaccines over the J&J. Myocarditis is heart inflammation, and that was not identified in the clinical trial. This is something that we've seen after we've administered millions and millions of doses of COVID-19 vaccine, but there certainly does appear to be a link. It would be lying if anyone said there wasn't. The highest reported rate, though, is those young adult males, probably in the 16 to 17-year-old age group. They have myocarditis occur at 74 cases per 1 million doses. That is probably the highest. Like I said, most common in males, but the vaccine-induced myocarditis is more mild than is anything caused by illness, because that's an important thing to know. Myocarditis can happen after COVID-19 disease as well. And it's a little bit tricky to detect because not everyone is getting tested for myocarditis, but it looks like it probably occurs in the 12 to 17-year-old male age group at more closely and after disease to about 800, 900 cases per million COVID cases in this age group. So that's much higher than anything caused by the vaccine. Not that there isn't a risk. It is important when we're looking at that 5 to 11, so that younger age group, to know that there's only been 20 cases of myocarditis identified out of 18.1 million doses. So this does look like it's something that happens, and we knew this kind of, or guessed this kind of already, in that young adult kind of teen to 30s age group. It's not something that occurs as often as you get younger and as you get older. This is just a quick graph from the CDC where we won't necessarily go through it, but you can see that myocarditis does occur most often after dose 2 of the vaccine. And again, no surprise, we've already talked about it. It does appear like it occurs in young adults, older teenager range more readily than the older group and the younger group. And we also get a lot of questions on long-term side effects. What is this going to do long-term? I need to know what it's going to do long-term. Based on our knowledge of these vaccines, the ingredients, and the experience from a lot of other vaccines, there are no long-term side effects expected. These vaccine ingredients clear from your body very, very quickly. They are not hanging out in there. They are not sticking around. And we're also not putting COVID-19 virus directly in the vaccine. It's just the spike protein. So really, we don't expect, and it would be quite frankly remarkably surprising if anything long-term came out of these vaccines. And there's been almost 600 million doses administered in the US to people 5 years and older. Quite frankly, if we were going to start seeing long-term side effects, we probably would be seeing them already. And then natural immunity, we've had a lot of kiddos infected. It's important to know natural immunity probably isn't going to do the same level of protection as a vaccine is. You certainly do develop some sort of protective antibodies after natural infection. It makes sense. That's probably what happens. But we don't know the duration of this protection. It could be 6 months, it could be 90 days, it could be somewhere in that range, it could be longer. We just don't know, and there is no way to predict it. And it is likely really variable person to person, depending on your age, how severely you were infected with COVID, your underlying health conditions. And that immunity may not be adequate as we get additional variants of COVID, which we seem to have happening more and more now. We really can't correlate natural immunity to protection of the same as the vaccine. That being said, probably the most robust immunity is for someone who has been already infected with COVID to receive a vaccine. That hybrid immunity is probably better than someone who has never been infected. Lastly, I just wanted to mention COVID vaccine for our younger than 5-year age group. There's been a lot of parents who've been waiting for this for a long time, and it might be almost here. Cannot guarantee a timeline, but it does look like this is maybe changing here shortly. So the FDA has come out and scheduled meetings now to review both the Moderna and the Pfizer vaccine for this young age group, and they're expecting to do this in June. The normal timeline for vaccine kind of authorization and recommendation is a little bit cumbersome and tricky. So we are probably about at that era right now. Pfizer and Moderna have both submitted to FDA on June 15th. So don't hold me to that date. They've changed it a couple times already. That data will be reviewed publicly by the Vaccines and Related Biologic Committee, which is an advisory committee for FDA. They will make some sort of recommendation. Your guess is as good as mine what that recommendation will be. That recommendation will go to the FDA, who could amend that recommendation, not choose to authorize any vaccine, authorize only one, authorize both. Really, the world's kind of open to them right now, but they will do something with that recommendation and update the EUA if they choose to authorize one of these vaccines. Then that data goes to the Advisory Committee on Immunization Practices, which is CDC's independent review board, and they will make some sort of recommendation for the use of these vaccines. They are the ones that actually put together the 2 weeks later, you get this first one at 2 months old. They're the ones that will kind of put together those recommendations. That meeting date has not been scheduled, but will likely happen days after the FDA decides to make a decision, if they make a decision. That recommendation then goes to CDC, who formalizes that recommendation and either changes it, endorses it completely, rejects the recommendation. They make the final say. After that recommendation from CDC, that is when providers in North Dakota can start receiving this vaccine and actually administering it to patients less than 5 years old. I expect, if things happen kind of how they have been happening, to this happen at the end of June sometime. Your guess is as good as mine as the actual date, and do not hold me to that date, but I'm really hopeful for the end of June. Like I said, we have 2 different vaccines, a Pfizer vaccine, which is 3 doses, and a Moderna vaccine, which is 2 doses. And you will notice a very different efficacy listed on this, so how good the vaccine is at protecting against symptomatic COVID. We do not know yet if this is comparing apples to apples. The only data we have seen are out of 2 news releases by the companies. Really, we'll have to wait for FDA to make that decision and really see what actually these 2 vaccines look like. But for now, this is the data we have. But I would really encourage you to talk to your medical provider if you do choose to get your kiddo vaccinated about which vaccine is best for you and your family. So lastly, I just wanted to mention next steps for you as a parent. A lot of people have been hit hard by COVID-19, the changing of the workforce, and may have lost their ability to pay for vaccines for their children. I just want to make you all aware that the Vaccines for Children program does exist in North Dakota. So this is a federally funded program that provides vaccines to children 0 through 18 years of age who are either Medicaid eligible, American Indian or Alaska Native, uninsured, or underinsured, meaning they don't have a insurance that will pay for vaccines. This limits the vaccine administration fee and does not allow participating sites to charge eligible patients for the vaccines. And we have a lot of vaccine for children providers in North Dakota. If vaccines are something that you just don't feel like you can do for your family because of the cost, please look into these providers. They exist in really every county in North Dakota, all of our large cities. Please don't let that be the reason why your child is going to get a vaccine preventable disease. There are options. But really, the real last step is talk to your healthcare provider today about your children's immunizations. We know a lot of parents have been busy during COVID. It's probably fallen to the wayside because you, quite frankly, probably have more important things on your mind. Please talk to your healthcare provider today because these are really important that we get our kiddos safe, protected, and up to date. And that is all I've got.
That was great, Jenny.
That was awesome, Jenny.
Yes.
I totally appreciate all the information and your knowledge. Oh my gosh.
Oh,
So
thank you.
that's just awesome. So I do have a couple questions though.
Yeah, of course.
So, you were talking about the flu and, I didn't maybe see it on your slide, but I've heard it from other people. So, during COVID, some people weren't getting flu shots because, nobody really knew, or they didn't trust any science that said you could get both. Do you think moving forward that'll change? Though now it seems like maybe some parents have paid more attention to flu efficacy vaccines than they did in the past, which seem to have been when they hear, like Pfizer's 85, 90, and flu is 30.
Yeah, so first off, you're right. When we first had the COVID vaccine, we were not giving them at the same time as other vaccines.
Yeah.
As it moved through the population, and really the reason for that was it was never because we didn't think it was safe. It was because we wanted to know what the side effects of COVID vaccines, so those fevers, the chills, the aches, were when it was just COVID. And it's really complicated when you're giving two vaccines to say what is for which vaccine. So that was kind of the reason why. Never because we didn't think it was safe. But we kind of figured out what the safety profile was of COVID, kind of figured out myocarditis and all of that. So then decided, nope, we can give them at the same time now. So really moving forward, now you can give any vaccine with COVID and it's perfectly fine. You're right. The flu vaccine, not perfect by any means. There are times where it's really pretty low, 30, 50%. What we really look for of the flu vaccine, though, is keeping you out of the hospital or keeping you from having that lifestyle change. So it's not going to be perfect to prevent you from getting symptomatic flu. It's just not. You'll probably get it, even if you've been vaccinated, but it will keep you from getting in the hospital. And for older adults, what we see is that if they're unvaccinated and get the flu, really, they'll have kind of a step back in their quality of care. So if previously to the flu, you were alone, independent, you may be now needing a walker or needing a wheelchair. If you were in an assisted living, you may take a step back to the skilled nursing facility just for your level of care. And that's really what we're trying to prevent when we're vaccinating for the flu.
Mm-hmm. So like, what kind of, do you guys like put out media or, because there are so many questions about that. And, I mean, both my son and I have lupus and Crohn's disease and those types of things. But even, going to different doctors, they're definitely putting their own opinion in whether you should do this or not. Or, I try to just go to the experts in our, lupus area when I'm thinking about vaccines. But like, is there education that you guys do with the doctors on a continuous basis? Since COVID's been around for a little over 2 years and people are sick of it, but I mean, it's still here. I can say that now because it's Danina here and we both agree it's still here,
Yeah, so we do education. I will fully admit it is tricky. The recommendations are tricky. They change a lot. So there are providers that are not going to be up to date on everything all the time. But we do try to do a lot of education with providers and we meet with them quite frequently. And then we try to keep our website up to date as well. If you go onto the Department of Health website, we have a lot of resources, probably sometimes an overwhelming amount of resources, but we try to push information out to really all levels of care through kind of our vaccine channels to make sure people are trying to stay on the same page.
Yeah. And so I won't keep up your time here, but I do have one more. Deneen's smiling at me. But so today was the first day. I actually got 2 calls from parents who want to get their child vaccinated against monkeypox because it's been in the news, right? And Biden's kind of put out a report, CDC put out a report. So I actually directed them to the Department of Health. And you guys, I'm just basically telling them I am not an expert in that field and, this is not an area of mine. Do you think if that keeps getting more publicized, I mean, it went from one case, I think it's 7 or 9 now, but totally different group. And, both these parents said, well, it was COVID that brought monkeypox here. And, I mean, there's so much right after you live through that epidemic. Now, anything new that comes up is going to be frightening for quite a few people. So I don't know if that's actually a question or just something I wanted to comment. Yeah.
So monkeypox is interesting. I did not think I would ever in my career be dealing with something that was similar to smallpox. I thought we were done with it. But monkeypox has actually existed prior to COVID. Not a lot in the United States, but we did have a previous outbreak of it, but really kind of over in Africa and in that population over there. As far as vaccine, at this point, there is not a routine monkeypox vaccine recommendation. And really what it's shaping out to be, probably, it's probably going to be a guess at this point, is that it may be high risk close contacts. So someone who's really had exposure to the monkeypox rash, or like close contact physically with this person for like secretions. I don't think we're gonna get into a spot where we're routinely vaccinating for monkeypox. Might be wrong. I've been wrong before, but at this point, I just don't see that happening.
Yeah, I was just a little floored today to get the call, I guess, because I was like, okay, I mean, I listen to the news, I know what's going on, and I know it entered, and I mean, I've known about monkeypox for years, but you know, when you just don't see it, and I do get calls from parents who say, you know, they say it's due to COVID, or, you know, I mean, I think COVID was something that was easily to, you know, link to everything. And so one of my last questions to you is, you know, when you are collecting that data and you kind of have those sentences where they say they died of COVID, they died with COVID, and it seemed like during the height of the pandemic, people were reporting differently. You know, and there were different sites that you go to, and all of a sudden one wasn't a good site, so go to this site and get the real thing. Do you think that has changed? Do you think there's more guidance on how states should report their data, or?
Yeah, I think so. So it's really tricky in a pandemic. So we base our kind of work as epidemiologists on something called case definitions, meaning that if you are reporting a case of pertussis in North Dakota, it's the same as a case of pertussis in Hawaii and Mississippi and wherever. So we're using that standard definition. The problem with the pandemic is that it happens really quickly and you don't always have a case definition.
Right.
In North Dakota, we really tried to report just cases of individuals who died of COVID, because that's really what people care about. But there were certainly states, and there's certainly still other countries that report everyone who died with COVID, they just tested kind of incidentally. But I think in the United States, there's really been a push to try to get numbers reported of COVID deaths. And we're seeing that a little bit more. And we're seeing, as we kind of have room to breathe, we're getting these case definitions that are a little bit more specific, so we can work and really try to report the same thing as states together.
Yeah, I think that's important because, you know, I mean, you hear some people say, well, children don't die from COVID. Well, you know, obviously they do, you know. And so, you know, I think about it a lot in that era, you know, because we don't expect children to die of anything really, right? I mean, that's just our mindset. And to know that there's, you know, COVID out there where, I mean, children do die from it, and healthy children, which is what I was really interesting to hear how you put that into perspective. So, Jenny, I thought you did a fantastic
That was
job.
great.
Oh, thank you. Yeah,
Yeah.
I'm really passionate. I really just feel like there's a way to prevent deaths, and it's crazy that we're just talking about not preventing deaths, but thank you.
Yeah, it was
Well,
really
and
good.
vaccines are such an important issue. You know, I
They
mean, I have a son with autism, so I know when this little people they didn't, you know, for me, I always just say, you know, I vaccinated my child with autism. Holy cow, yes, you know. But, you know, there was that era in there too. So, but I think, you know, a lot of times parents are, you know, they're not really getting maybe really good facts about vaccines and stuff. So you could talk to me more and more and more about vaccines. I'd stay on for another hour.
Oh, thanks.
Jenny, are you seeing a lot of a decrease in the overall vaccination rate in
Yes.
COVID?
Infants, not so much. It looks like people kind of keep up to date in that before 12 months age, which probably is because you're going to a well child visit basically every month for the first year. But after that 12 months age group, they do definitely look like they're dropping off. It could be in part to hesitancy that's coming from COVID and just kind of everything that's happened with COVID and COVID vaccine. But I think a lot of it too is just parents have taken a lot of time off of work over the last couple of years. They're staying home with their kiddo because their kiddo's in quarantine. They're sick, their kiddo's sick. Like, they have taken a lot of time, and people don't really make the time as much to go to a doctor when their child is healthy. And that's kind of, I think, part of the issue is that we have this perception that our kiddo is healthy and that we don't need to go see the doctor and we're all okay. But yeah, our rates have dropped off. For our kindergarten immunization rates, I believe they fell, oh, don't quote me on this, like 2 to 3% over the last year, which again, doesn't seem like a ton, but when you're looking at 95% protection against measles, even that 2 to 3% drop is a pretty good drop.
Mhm. Okay. Well, I hope that we're going to post this up on the website, and I'm hoping that, we can help families provide that education for them to decide what to do with their kiddos. I know that, I mean, that's been a really mixed bag, really, for a lot of families on do I, don't I? I didn't get vaccinated, so I'm not going to vaccinate my kids, but I don't know. I've always been on the side of the protection.
Yeah.
And
And I don't think there's anything wrong with questioning either. I think it is in our human nature to question. We want to make sure we are doing the absolute safest, best thing for ourselves, for our kiddos. But I think it's really important, and Vicki, I think you touched on this, people have a lot of information coming at them from a lot of different sources. Being able to critically read scientific data or just know who to talk to, like your healthcare provider, when you're making these decisions, I think is going to be really important going forward, because social media certainly has a lot of information, not all of it correct.
right, yeah.
Right. And I think COVID made that worse because there was so many views on COVID and how it did, I mean, I never really remembered hearing a ton of that about flu vaccines, different vaccines, and then some have been eradicated. But it definitely is concerning and should be concerning to all families if your vaccination rates are going down, because, that's basically how we got rid of some of those as, very deadly diseases. But yeah, COVID was tricky, still is tricky.
And really for our population, Vicki, I think, a lot of our kiddos are immunocompromised. So having some direct information from you all, I think is vital. So
Yeah,
I really appreciate you helping tonight, Jenny. So we'll get
Yeah,
this
of
up on the
course.
website. And
Yeah, I'm going to direct quite a few of my families to go to the website and listen to this. So, because it was excellent.
Perfect. Sounds
Yeah.
great. Thank you so much. And thanks for inviting us. We're always willing to talk about diseases and immunizations. So just let us know if you ever need anything else.
Sounds good. And we'll talk after this, Jenny, too, sometime. Okay.
Yep. I will shoot you over some email.
All right.
Thanks, Jenny. Have a
so
good
much.
weekend.
Yeah. Thank you.
All right. Good night.
Good night.